all the listeners of Health Education Lecture Series. I'm your host, Gurdeep Singh Sandhu, homeopathic consultant. My clinic address is 9701 Sarah N. Court, Dublin, California 94568, and phone number 408 687 1899. Anytime, at any age, for any disease. When you are tired of any treatment, please call me for best advices for your treatment. And also, if you want to be get treated with homeopathic scientific approach to your health, call 408 687 1899. It's not only that you are just getting treatment from me, but even for the second opinion of your disease, you can call me. There is no fee for the consultations. And after that, I can guide you why and where your progress of treatment has stopped and what are the reasons behind that. Because nature itself has a scientific process, a way how the nature was curing the diseases before the medical science was existing. And after at that time, every disease, persons were suffering from the diseases, every disease was cured, and that's why we are surviving. That's why it's the proof of the life that the life was stronger than the diseases, and that is why we are surviving. It means diseases were coming and diseases were cured, and ultimately the life was stronger. And life means the nature was stronger than the diseases, and it was covering all the diseases time to time. And there was a way. There was a way how the nature was curing all the diseases. Nowadays, we have different divisions. Some of the diseases are considered as acute diseases, some of the diseases are considered as the chronic diseases, and various system of treatments are now existing in this world. And some of the diseases which are considered by one of the system that these are chronic diseases, and those all diseases are not chronic diseases in other systems. They are able to cure them with a better adjustment, with a better medications as well, or means to use the power of the medications, use the medicine power of the substances which exist in this universe, and we are now able to cure some of the diseases which were considered previously are chronic diseases. And also, we are following the role of nature, what the nature was adopting before this medical science exists in this world, before we have the datas and collections of the previous world, how the people were getting cured from the sicknesses. Sicknesses are since very beginning. Sicknesses are the hurdles in life, and hurdles are since the start of this life from the sperm and ovum. They meet, and after that the hurdle starts. Even before that, there were hurdles in the life of the sperm. There were hurdles in the lives of the ovum as well. And but when they meet each other, they have some common strength, and even then they were having some problems. And those problems were called hurdle or the diseases, or the diseases in the life course of the life. So in this way, those things were time to time recovered by various other means. Time to time, I'm telling about those things which were the natural things which were curing the diseases, which were helping this human life to survive. And we are now, the medical science has followed those things regularly, that how everything, just like measles. pox. There are various kind of diseases which now we know that they have their limited periods. They come over the system, and then after that, if they are not controlled, if they are complicated with something else, they can take the life, or they can damage the organs, or they can make a problems for the life. But if that disease do not have any other complication, is not adulterated by any other disease, then ultimately it has a limited time period, just like the diseases of the viruses. We know that they have their limited periods. They work inside our body, and ultimately their lifespan is over. And ultimately, if we survive till then we are surviving. And nowadays we have we have different means to protect the life from these kind of diseases. Even then they are virulent. They are virulent if during the course of these diseases, if someone is adulterated, if someone is complicated with some other diseases, because of environment, because of a food, because of the living habits, everything, if it is complicated, ultimately it may be a more dangerous for the human life, with which it can take the life, or even if not taking the life, it can take any part of damage, can damage the part of the body or systems, and then a person may become handy lab throughout the life. We have discussed time to time about the pox, about the measles, and all that was coming up on the systems. But we have learned from the nature. If we follow the way of nature, even nowadays, from in our treatments, and yes, that may be a little bit longer, but it will cure permanently the conditions of the sickness, and ultimately the person will survive with a complete health. Whereas nowadays the with the introduction of the medical science, definitely we are surviving. Definitely various things which were going worse, which were going to be complicated in a normal routine way, and many deaths were occurring because of those diseases. And now we are able to protect those lives with the immediate medical assistance, with the immediate medical techniques we are adapting nowadays, just like the vaccination and all those things. They are helping the life. They are helping the life, and we are able to save many thousands of lives every year. And in this way, I'm talking in this system, in case if you are suffering from any disease, and during the course of your treatments, whatever the treatment you are taking, from wherever you are being treated, if the progress of the treatment is stuck up somewhere, if you are not getting cured in a limited period, whatsoever has been prescribed for many of the diseases, just like I had told you about the tissue damages. Okay, what type of tissues in the body are damaged by any disease? Then we can forecast that it will take this much time if it's not complicated. If not complicated, we have a time period to recover the different kind of tissues, just like the epithelial cells are recovered within 3 to 7 days. Bone tissues are recovered within 6 weeks. And in this way, all the different type of tissues have their specific period that they will be cured. They will return into life again. But our purpose is to treat, to protect them from other complications. But if during the course of any disease, if during the course of any treatment of any disease, you are not getting well in a specified area, in a specified time periods, yes, you can consult me and I can tell you what are the hurdles over there. What are the problems over there, so that you can adopt a normal, natural way for your treatment wherever you are. But if ever you consult me for that one, then I can give you the good advices based on the natural principles, and you can get well soon in a due course in a specified time period. So that is why in these lectures, time to time, I'm giving you the informations that this body, this structure is formed by what organs, in what reasons, what are the organs, and how they work, and if ever they fall sick, if they become sick, ultimately what we can see outward that they are sick, and what particular organ is sick, not only the systems, but only a particular type of organ now we are able to recognize. Just like I told many times in this way, that if liver is damaged, there is a cholesterol. Just for example, I can give you one example. If there is a cholesterol in excess and continually in one body, you will see some signs of below the eyes, they are white yellow patches. These are basically yellow patches, you can say that. And lipids is there inside. And even if you remove that one by surgical means, even if you take care of this one, but it indicates that something is wrong in the liver. It's later on, it is later on that you go to the lab, you get checked, and the doctor or the lab technicians tell you that yes, you are having high cholesterol. But nowadays, many of the things which are told by the labs, which are explained by our doctors, that you are having this, and the proof of this one is that the lab test said this one. So, whatever the lab test said, they interpret this one and explain you that this type of organ is damaged inside your body, and this is what going wrong inside your body. In this way nowadays we are able nowadays we are able to recognize most of the things, just like I told you about the cholesterol types of things on your eyes. We are able to recognize outwardly, before going to the doctor, before going to the lab test, that what a particular organ has been damaged inside the body, and this is the sign of that one. Just we need the proof. Just we need the proof that how you can say that one. Just like I told you about the cholesterol. In this way, for each and every organ which is inside the body and working normally and producing a normal healthy life, when becomes sick, and every organ indicates outwardly that I am sick. And what way it is sick, it is indicated outwardly on our skin, our face, on our every behavior and everything. That if you are known to those things, you can recognize that he is having this kind of problems. And we started this chapter from the brain, from the head. And I have told you, if ever anything, separately, we will start with the cerebrum, cerebellum, mons, and medulla oblongata, many other organs which are situated in the brains. And when they fall sick, the individual organ, when falls sick inside the brain, what will be the indications? But most of the indications are common. Most of the indications are common, and I will tell you each and every organ's common informations, so that you can recognize that this part of the body is sick, and what possibly it can have. Before going to the doctor, you will recognize many things, so that you can immediately get the required department of the hospitals and get help very fast. But if you are not knowing to all these things, then what will happen? You will go to the general line of the hospital patients, and ultimately then they will recognize it, what you are going with, and then ultimately they will refer you to the particular appropriate department, and then they will start checking your body, and then after that they will be giving treatment. It will take a long time. So, whatever lectures I'm doing here, my purpose of these lectures is that you should be aware of those signs before you go to the hospital. When any person becomes sick, any organ of the body becomes sick, it indicates something outwardly. And then, if you are known to those signs, you can easily understand what's going wrong inside my body. So in this way, systematically, I just told you about that the brain things, and then after that, I told you about the neck things. That what are the organs in the brain, what are the organs in the neck, and if they fall sick, if there is something wrong with those organs, what are the indications outwardly? But now we have reached to the area of chest, and in my previous lecture, I have described about the chest area. Basically, the chest area is a part of the trunk. The main trunk area is below the knee, below the neck. The trunk area is below the neck, starts from the clavicle bone and the manubrium sterni upward and down. It is up to the uh, pelvic brim. At that time, this whole area was known as the trunk. But this area, for easy recognition, for easy understanding, for easy getting informations and treating them fastly, medical science has divided this trunk area into different parts. And those different parts are, the first of all, the abdomen and the chest are divided with the membrane that is known as diaphragm. And the diaphragm divides this trunk into two portions. The upper portion, which is covered as a cage like by the ribs, by the bony structures around it. Back side, there is a vertebral column. In front, there is a sternum, and on the sides, it is covered by the ribs. And back side, there is a scapula, right side and left side. So ultimately, this cage is formed. I have already described about this thing, how this cage is formed and how the ribs are recognized. What are the 12 ribs, seven fixed ribs, and three adjoining helping ribs, and the two floating ribs. And in this way, I have described you about that one, and why this is like this one, why their position is like that one. I have already described you that as long as they go downward towards the abdomen, abdomen needs more flexibility, more dilatation under certain conditions. This way, the false ribs can expand more, and false ribs can give more space to the abdomen. That's why the other two ribs and downward on right side and two ribs on the left side, they are floating ribs on the abdomen side, but they are joined, they are fixed with the vertebral column as well. So this is what I told you about the structures. But this structure is separated from the main trunk or from the abdomen, because the trunk has two portions. The upper portion is the chest, the lower portion is known as the abdomen. And this is separated by a membrane which is known as a diaphragm. And the diaphragm has several openings, mostly seven important openings. Several openings through which various organs, blood vessels, structures from upward goes downward, from downward goes upward. They are connecting their function with the upper side of body and with the lower side of body, so that they pass from that diaphragm area. So this is what I have already described you about this thing, that this is the chest and the joints, sternum, body, xiphoid process. All these things has been described, and even uh, uh, underlying organs in this cage. Because why God needs to make the cage of chest wall, just like the abdominal structures I have explained about that one. The most important things we put them in our safest area of the home, that is the safe, and they we keep all the paperwork preserved in the safe. The same way, the important thing which is controlling the whole function of the bodies, though organs are there, but organs are controlled, functioned, helped by the brain, guided by the brain. That is why that's the important organs inside the skull. So it is covered by a skull, the brain organs. And after that, some of the organs which are more important, but even then they are still safe, they are in the neck. Also some of the organs which are passing from the neck, and they are also important. The important area of the neck is also covered by a bone like cartilage type of things, which is known as trachea. So in this way, wherever it is required, the nature has put something different structure which can protect those organs, which can protect those areas from the outward injuries. And in this way, this body is formed. But now I'm talking about this chest area, that this chest is the upper part of the trunk and separated by diaphragm from the backward to front up to that area. A flat membrane is covered, that's also known as phrenic, having different opening so that the relation between the chest and the abdomen is maintained. And after that, I have already described, and again I will describe when the abdomen part will come up, that this abdomen is also divided into two portions. But that is the internal portion, the outward, just like the chest has a bony structures. Abdomen is not having bony structure in front, and the whole abdomen is not having bony structure in this way as the chest is having. But even then, the abdomen proper is divided into two portions for easy understanding, for easy and also separating the functioning of this body, that which is not having this diaphragm type of structures, but it has a different kind of structure, which because the outward skin, outward the boundary of the abdomen is the same. In the chest, it is not same. Only the skin remains, but all other structures are different. Whereas in the abdomen, the whole area outwardly having the same wall, but internally it is divided, and it is divided by the peritoneum. And the peritoneum has two different sections. A larger, bigger section is known as greater sac of peritoneum, and the smaller pelvic area is having lesser sac of peritoneum, is also called broad ligament. In this way, it's internally. Outwardly, it looks like same. Outwardly it looks same, but internally they are separated. So in this way, every portion has different organs, and every organ has a different function, and all the organs are having united or channelized to complete one system. They may be in any section of the body, just like heart is in the chest, but its a system or its a connection is throughout the body. In same way, many of the organs, they are situated in one part of the body, but they are having their jurisdiction, you can say. They have their jurisdiction throughout the body. And whenever any organ, any system, any part falls sick, it indicates some type of signs outwardly, so that you can recognize what particle system has been damaged by sickness, or what what special organ has been damaged in that system. And that will be known by the outwardly expression of the disease, that is some of the symptoms. And I'm telling you about those systems. So first of all, I described about this one, that most important organs which are inside the chest. Back side there is the vertebral column, in front is the sternum, and I have described three portions of the sternum. Upward, there is a clavicle bone on the both side, right side and left side. After that, there is the manubrium sterni, which unites this clavicle bones with the sternum upper portion, and then the body of the sternum, and then the xiphoid sternum. And on sides, I have described about the ribs, and all these ribs. I have told you that there are seven ribs are uh, fixed ribs. You can say the fixed ribs means they are united with the sternum and they are united with the vertebral columns, back and front. Whereas the three other ribs are not united with the sternum, but they are united with backside in the vertebral column. But one by one, they are keeping hand closed with each other, and just like eighth rib is uniting to the seventh rib, and ninth rib is uniting to the eighth rib. In this way, they are backing up and giving more space to the abdomen, and abdomen enlarged in this way. And after that, two ribs, I have already told you about that one, that these two ribs are floating ribs because they are not attached in front, but they are only attached at the back side. So they can float with the extension and distension of the abdomen. So in this way, when we are talking about the chest area, I have described you about the esophagus, about the muscular. It's a type of muscular tube from the trachea downward. Trachea, part of the neck. After that, the food pipe, which was coming from the mouth and the neck, and ultimately at the type, at the area of trachea, this food pipe is given another name. After that, it's given another name, that's esophagus. And there is a junction. Nose, from the nose downward, a larynx type of tube is coming downward, and at the time of at the space of epiglottis, it's also changing its route. Larynx comes in front, food pipe goes to the backside, and backside this name is changed esophagus. In front side, when the respiratory larynx comes in front, it is divided into two portions, and the name is changed and also known as a bronchus. So these bronchuses are going to the right and left lung both way. So this is what the structure wise I have told you internally. And after that, I described about the structural internal structures of the chest wall, that there are uh, three, you can say the two main important organs. First of all, others are pathway. But on both sides, there are two lungs, and these lungs are covered into a sac that is known as pleura. So, when you start describing the internal structure of the chest, you can say there are two pleural sac. Two pleural sac, they are covering both the lungs, right lung and left side of the lung on both sides of the chest, inside. And in between the lungs, there is a heart, mostly situated on the left side, and a small portion, 1.2 centimeter area from the mid sternal line, from the sternum to right side, it's only 1.2 centimeter area. That is of the heart area, you can say. Otherwise, the total heart area is on the left side and in between the lobes of the left lung. So in this way, but this heart area is also separated from the lungs by a covering that is known as pericardium. So with the pericardium, this structure is separated from the pleural sac or pleural covering. So these three main organs, two lungs and one heart, we have described about that they are the main content of the chest. But other things are bypassing. Many of the things from upward goes downward. Many of the things from chest goes upward and also goes downward. And just like from the heart, aorta is released from the left ventricle, goes upward. In the backside of the manubrium sterni, at the level of second rib, it turns backward. Alongside the vertebral column in the backside, it goes down and pierces the diaphragm and goes downward. And also, from this aorta, the first portion is known as ascending aorta. After that, it takes a curve, and that is known as arch of aorta. From the arch of aorta, two blood vessels, main blood vessels, those are known as carotid and coronary arteries. They are released from there, or they are taking place from origin from here and goes to upward to supply the blood circulation and oxygen to the brain, and the rest blood goes downward to supply the whole body up to the feet. Or in this way, these structures are passing from a area that is known as the mediastinum. So media means mid, sternum means back of the sternum. So in the back of the sternum, there is a common area through which all the structures which are coming from the brain pass downward to the chest as well as to the abdomen as well. And some of these structures, just like inferior vena cava and superior vena cava. Inferior vena cava, which is bringing blood back from foot to heart, and superior vena cava, which is bringing blood back from the brain to the heart. So means the circle is completed. Blood goes from heart to the whole body. Comes back from the whole body to the heart. So these are all structures are passing. These arteries and these veins are passing from this mediastinum and goes upward and downward from that one. And one thing more I have told you about that one, that wherever there is a artery, there is a vein. Means if the blood will go, definitely it will come back. So throwing blood from the heart to each and every tissue, these blood vessels are known as arteries. And blood coming back from each and every tissue after being used, that food is sucked, oxygen is sucked from this blood by the tissue, and that blood is coming back again. Basically, blood, you can see a vehicles. It's a type of vehicle, car, scooter, motorcycle, by which we are transporting something. So blood is a transporting media which is transporting the food materials and everything to each and every tissue, every cell inside the body, and starts from the heart. And ultimately it comes back. But when it comes back, oxygen and food materials has been taken by time to time, space to space, by the cells, and every cell is throwing out its garbage. Garbage may be gaseous, garbage may be other substances, whatever it is. It is throwing their garbage out. Those structures are known as veins, and the veins are going back to the heart. So these are known as veins. Means oxygenated blood is carried by the arteries, deoxygenated blood is carried by the veins. There is one description I told you about that one. In the change, you can say there is a change when we are talking about the pulmonary artery in the heart. I'm just coming over there. The pulmonary artery drains deoxygenated blood from heart to the lungs, but we say it artery. And also There was one more thing I have told you. If those peoples are continuously listening my lectures, they might know this thing, that when I was talking about the embryo or the fetus inside mother's womb, there was also a description this kind of change, that oxygenated blood, full of oxygen, full of food material, is coming from the mother side, from the placenta to the baby. But that particle substance, that particle vessel, that is known as vein, and that vein drains the oxygenated, means healthy blood to the fetus, whereas this blood circulating through the body of the fetus ultimately go back to the placenta, and that is known as just reverse of that one, that is known as arteries. But these arteries are containing deoxygenated blood. The same way this change is still in the heart area, when right ventricle is constricted, and whatever the blood in it that is collected from the outside of the body goes to the lungs, and that is that is, you can say, the deoxygenated blood, and it goes to the lungs via pulmonary. That's known as artery. Basically, it should have been named as vein, but no, it's artery. Okay, so there are some changes, some exceptions in the system, construction system of this body, and ultimately it goes to the lungs, and then when by four veins, a fresh blood with oxygen, carrying oxygen, relieving the carbon dioxide in the lungs, and coming back to the heart again to be supplied to the whole body, they are known as veins. Change. So in this way, there are at few places there are some types of changes I will tell you time to time, but I am talking about this one, that the mediastinum. So mediastinum is the middle portion of the chest, from sternum in front, vertebral column in the back side, in between the two lungs, and also you can say the heart. This whole area from neck downward up to the diaphragm, this area is known as mediastinum. And this mediastinum is a type of pathway through which essential substances, organs, vessels, these type of things are passing upward and downward, both way. It's serving for that purpose, and that's a very important things. That is a very important thing that has been covered by the nature. On both sides, there's a lungs, but this middle area could be injured from the front side directly or from the back side, and in the both way nature has given us the bones, hard bones. Back side there is a vertebral column, in front there is a sternum, so that this important area, the important structure are passing from this area, it should be protected, and all these things are going. So in this way, the cardiac, just heart, all the vessels which are going to the heart, which are coming from the heart, they all are passing through the mediastinal area. So, whereas we have talking about the muscular structures, we have just talked about this bony structures, and the muscular structures are the diaphragm. I told you about that one, and that forms a floor. You can say the floor of the chest, because underneath is the abdomen, and up to this one, this is the floor of the chest, you can say one, and this whole chest is covered by, above the ribs, above the bony structures, is covered by some muscles, Just like there are four different muscles in the chest: pectoralis major, pectoralis minor, serratus anterior, and subscapularis muscle. These are the muscles which are protecting the ribs as well, which are giving strength to the chest wall so that the inner organ should be protected even from the external injury. In this way, all these things are covered. The other muscular structures also I would like to explain again, that is the intercostal muscles in between the ribs, so that the ribs should remain at their equal distance and can give a full strength to the cage of the ribs. Those muscles which makes a equal space in between two ribs, in between each ribs, that is known as intercostal muscles. And there are also cartilages which unite the ribs with the sternum in front and which unite the ribs back with the vertebral column. So these are the cartilaginous structures. They are hard type of things. They are not basically bone, but they are hard like that one. But they are protecting their joints over there. So in this way, this whole is things. And major blood vessels I have already talked about: the aorta, inferior vena cava, superior vena cava, all these things. Upward going the carotid arteries, downward going the thoracic abdominal, thoracic aorta, and then abdominal descending aorta, and all that. All these things are, and after that, I have described you about the nerves and the lymphatic, because all these things are going side by side: artery, vein, lymphatic channel, and the nerves. So all these structures are going to each and every cell's door. All these structures are going back from each and every cell back to the stream. So this is what the normal about the chest. And then after that, suppose if you have any problem in your chest, if you have any type of a problem in your chest, the first thing what we notice in anything, basically, to indicate, to recognize any disease, the human being, the human race has a word that is the minimum word which can explain the things, that is pain. When this body is not performing normally, whatever may be the reasons, it's not performing normally, and to indicate that, the smallest word which is used, that is the pain. Or in this way, after that, we describe this pain: what is the nature of the pain, where it is, to whom it may be related, and what it may cause. All these things are further description, further description of this pain. But first thing, whenever any problem comes in the chest, the first indication is the pain. Second, lightheadedness, because it is possible, because these are the general signs I am describing at this time. General signs, you can say, they may or may not be. It's not necessary that all the sign I will tell you will be in each and every patient. No, because there are different organs, and their different organs, when they become sick, they are indicating themselves in a different symptoms, different outwardly expressions. But in general, what happens, this is what I am describing here, that is the pain, lightheadedness, and sometimes an indication from the chest to radiate somewhere. Pain mostly related to the heart, radiate towards the muscles, radiates towards the arteries, radiates towards their nervous junctions. So most pains are related with the heart are because of the blood circulatory system, that is the vascular system, and they are indicating or radiating towards the shoulder. But there is carotid artery. Sometimes, if there is any problem in the circulatory systems, this pain may extend or may radiate. Radiating means from one place to the other. It is going from one place to the other. One thing I would like to describe you here. There are two English words. One is radiation, the other one is migration. Many doctors use this thing, migrations. That I can explain you very easily. Suppose from India you are migrating to any other country, you came to America just like it. Now your home is not there, and you are now here. Your home is in USA, in America. So this will be described as migrated. But if you have your home in India as well as you are having your home in USA, it indicates radiations. And another example, suppose if you are making some stuffs, and just like if we are any vegetable or anything else, you are putting in the pan and you are holding the pan in your hand, and as this metal pan will become heated on the stove, your hand handle will become get the heat, and this is known as radiating. The heat from the pan is radiating to the handle of the pan. That is radiating. But if this is not just, if the disease is somewhere in the abdomen, along with that, it is still there in the abdomen, but you have a headache, it it is known as radiation. There are many more types of pains in the body. They are radiating. They start from in the one area and they are radiating to the other areas, but they are still on the both places. On the both places, then this is known as radiating pains. Radiating pains shows a type of link between the two places. You must know that. And the other thing, I can tell you, suppose if you have a pan, you have a handle, and the handle is a wooden, and your pan is being heated on the stove, and your hand is not getting the heat. That means different from the radiations, migrations. Okay, so this thing that it is not there, it's there. So in this way, when any disease inside the body from one area goes to the other areas, and there is no any point of the previous place where it was started, then it is migration. Most of the times in the headache, pain in the head, this is described by the doctors, migrations. Because all you know that there are different organs. Previously, they were not knowing. You know that head is one organ. And there is no question of migrations. There is no question of migrations. But migration come in existence when from one organ, from one part, it goes to the other, and both things. Radiating means just like I have a headache on the right side, and also from the right side, it has gone to the left side. At the same time, I'm having a pain on the right side and a pain on the left side. It has started from the right side, but now it is on the left side, and both way I have a pain on the right and left. It is radiating. It is radiating from right to left. But if I was having a headache on the right side, but now no, it's not on the right side, it's on the left side. Yesterday I was having a pain on the right side, and now it is on the left side, it is no more on the right side. This is known as migrations. So, in this way, first thing, this is the little thing we describe it. We are talking about the sign and symptoms of the chest when any organ becomes sick inside the chest wall. It indicated by the pain, and that pain may be like dull head, and pain mostly may be radiating, means also if I'm saying the headache and pain is coming from the heart or pain is coming from the chest, it means from there it is radiating over there. It means the organ which was basically affected is still having that complaints, but it is also we felt it on the head. So mostly chest problems are or may have, it's not necessary, may have this kind of symptoms that known as pain. Second, we know that whenever the chest area is a compact area, there's no vacant space, you can say. There is no I give the example of the pond many a times, that if you throw a conker stone in the uh, pond, you see the waves are going around and around and around. It goes to the bank, up to the bank maybe half mile or whatever it is. It goes over there, it is felt on the bank. There's no gap inside the body. So in this way, second symptom is felt if there be any problem in the chest, maybe heart, maybe lungs or anything, pressure. Even even if you are having a gas problem and gas or acidity is passing from the stomach upward, it is passing through the mediastinum, it is passing through the chest, and what you will see, pressure. If there be any enlargement or distension in the heart chambers, if there is a distension or constriction or whatever in the lungs, because chest cage is compact cage, it has a limited dilatations, not much like abdomen. Limited dilatations, it means if anything extra comes to this one, either passing or staying over there, it it is indicated by pressure and tightness. So whenever there be any problem in the chest, you will feel pressure, you may feel tightness. You should use it may feel. Sometimes people may not feel it, but may feel tightness, may feel pressure, and also shortness of breath. If ever anything happens with the heart, if ever anything happens with the mediastinum, if ever anything happens with the lungs, if it is directly with the lungs, definitely we will be having a pain, distress, breathing distress, or shortness of breath, you can say. And if any other organs are involved, and the function of the lungs is obstructed, automatically you will feel distress in the respirations. And also, in general, we will talk about these, particularly by the heart, by the lungs, by the intestine. But in general, suppose if there is a problem in the heart, then you may see sometimes sudden swelling, sometimes gradually increasing swelling. Mostly people see swelling in the ankles in the evening time, but when they wake up in the morning, there is no swelling. In this way, it indicates something is wrong with the heart. Second thing, problem may be with the lungs, problem may be with the heart. Both these things indicates the if there is a not sufficient supply of the blood, it means the oxygen is not supplied properly what is required. It indicates the food which is required by the cell is not supplied by the circulations. Both way, lungs may be involved, both way, heart may be cooperating with the lungs, or the lungs may be cooperating with the heart. In whatever way, under these conditions, there will be fatigue. If there is a lack of oxygen, it indicates fatigue because cell cannot work. Everything is there, but we cannot survive without oxygen, and the maximum period has been noted that it is 3 to 5 minutes. If respiration has stopped, if heart has stopped for 3 to 5 minutes, and it is very difficult to recover it again. In this way, and what they are doing, lungs are supplying oxygen, heart is supplying, transporting that oxygen to the tissues. It means if anything happens with any of these two organs, it will be indicated by fatigue, means it's not completely absence. But gradually and gradually, there is a lack of oxygen in the cells, and ultimately that is indicated by the fatigue, thakavat, tiredness. Everybody will feel when we feel tiredness, it means our muscular structure is constricted and not sufficient oxygen is going to the cells. That's why we feel tired. We want to take rest and relax. When you relax, oxygen goes to the cells and we feel fresh. In this way, if there be any problem inside the chest, maybe heart, maybe lungs, you will feel fatigue. This is rapid, irregular heartbeat in all the conditions, lungs or of the heart, especially if there is not sufficient work they are doing, whatever is required by the body, means to supply the oxygen, to supply the food materials, and ultimately they are to run more. They are not carrying the sufficient load, but they are to run more to complete the demand, demand of the cells. So in this way, there will be rapid, irregular heartbeat, indicating that there is a lack of oxygen. After that, if all these conditions, I told you about the pain, I told you about the tightness and chest pressure in the chest, shortness of breath, and sudden swelling, all these things are happening. And regularly you are seeing that, yeah, since 1 week I am having these and these problems, breathlessness, tightness in the chest, and sometimes pain in the chest. All these things you are telling to some persons gradually, these are increasing, and ultimately a stage will come, you will feel dizzy, you are tired, you are in fatigue, and somebody tell you, okay, go and work. You are under someone, and he say, go and work, and you wake up. And when you wake up, but you do not have sufficient oxygen at that time, it will produce dizziness. So dizziness, and also sometimes nausea. This nausea is a forceful expulsion of oxygen from other parts to supply to the desired organs. In this way, a pressure is created also in the stomach, and we throw up, we vomit. So all these things are the indicating sudden. There are still other signs we'll discuss in the other lectures, but these are the most important signs I told you about the chest. that these are the important sign in the chest, that if you see any person is having this kind of signs, you can send him directly to the chest department, cardiac department, or pulmonary departments, thoracic. Okay, so thoracic may be a one section in the hospitals close to each other. They may be dealing with the chest, they may be lungs, or they may be dealing with the heart, or whatever it is. So it means if you know these kind of symptoms, immediately you will transport your patient to the this department, chest department. So in this way, you can help him. So our time is over. I am your host, Gurdeep Singh Sandhu, homeopathic consultant. My clinic address is 9701 Sarah and Court, Dublin, California 94568. Phone number 408 687 1899. Email address homeomedicine, HOMEOMEDICINE @yahoo.com. Anytime, if you are suffering from any disease and you want to take second opinion, you can call me at 408 687 1899. It's a free consultations. You can take my 52 years experience in questions, and you can get your answer about your disease or about your treatment as well. But even if you want to take a proper scientific type of treatment of homeopathic system of treatments, yes, you can call me 408 687 1899. And if ever you think better that these lectures are beneficial to the humanity, beneficial, and you are getting some very important knowledge from these lectures, please convey this message to the dearest and nearest of your family, so that they can listen. They can join my Facebook area, Facebook media, homeo medicine of yahoo.com, and also the YouTube. It's also a channel by Dr. Gurdeep Singh, YouTube channel, and also the Sabarang radio station you can join, and you can listen these lectures every day from 5 to 6 p.m. California Pacific Standard Times. And you can listen this radio all over the world, anywhere, if you download the apps, downing the app of sabrangstation.com. Sabrang, Sabrang, sabrangstation.com. So this is the app you can download in your phones, and you can listen 24-hour programs all over the world, anywhere, wherever you are in your iPhone and Android phones. And in the morning time, you can listen Gurbani, Bhajan, Shabd Kirtan, and Rangarang programs, filmy programs. All these things you can listen. And at the evening time, every day from 5 to 6, I am at your service to give you the knowledge about the health, about the sickness, about this body, and how it works. So, Rabarakha, God bless you all. We'll see you tomorrow, and we will deliver this lecture in Punjabi. Thank you.